I believe we are in a session for smart cities and infrastructure for reimagining urban life. I believe we have Ibrahim Al-Mutawwa, project manager from Elder Tower Contracting. Is Ibrahim with us?
Yes.
أهلا وسهلا Ibrahim. And then we have also Dr. Abdel Boualam from Moroccan Artificial Candy Operation. So, Ibrahim Mutawwa, welcome to this session. And we hope that everybody enjoy your presentation and speak, and the floor is yours.
Thank you for introduction. You can see my presentation clear?
Yes, yes.
Okay, thank you. My name is Ibrahim Al-Mutawwa. I am a specialist in solar panels and also IoT system. Today I'm gonna to speak about the IoT system and what is the use. So the problem is many people nowadays, they still use people to find, for example, maintenance or something like this. So with IoT system, we can use this technology and no need to use manpower, and also easy to catch, like, for example, issues, and also to control it by internet. For example, if you have any problem in a site, light issues or something like this, we can by an IoT system catch these issues without send people to there. So by a system, you can find this one easy, and you like short time the things and you do it very fast. So today I'm gonna to speak about what is IoT system, and what is the unit, and what is the application, and how we can use it for smart city, and also what is the benefit from this. Actually, the topic of this things is very big, but I try my best to keep it for 15 minutes, as much as I can. So IoT system, it's a standard for something called Internet for Things. So means you can control many things by internet. Anything you can control it by internet, by SIM card, by Wi-Fi, by something like this. So this is the basic things of the IoT system. So you can know the location of the parts or for the equipment. You can like understand how it's work and where it's work, the temperatures, all of these things. Easy to control. You can get report. You can get many of things very easy by one click. So,
Mr. Ibrahim, if you, sorry for interruption, but if you can just put the screen view on top, the full view.
Okay.
At the bottom, there's a click like for full view for your presentation. Or you can click slideshow, for example. Sorry for interruption.
No
just
problem,
for a slide to be more clear for everyone.
Is it okay now? Or same?
It's the same, but at the bottom, yes, here, where's your mouse at the bottom of the slide? Yeah, can you click this one? Yes.
Okay. Now clear?
Great, super. Thank you.
Thank you. Thanks for your help. So I'm gonna to speak about the application, and I choose some product which is me and one Chinese company modified it together. So what all the product you can find here, it's real product, and we tested and we final design with the now all the application I'm gonna to show you. So the first application, we use the smart IoT system for the street light. I'm going to speak about this and how it's happened. Before, the light, if there is any problem, we have to send an emergency car to go and check the light and need time to check and find all the issues and everything. Nowadays, with IoT system, by one click, it can indicate this by SCADA system, so easy to find where is the issues in this street light. In the past, many people, they invest a lot of money. I mean, many government, they invest a lot of money to keep one car at the night to round and you just checking how many light is not working. But with IoT system now, you can easily know if there is any light not working or something like this. And also, you can use this technology and put CCTV, and you can control the CCTV, and very easy to do that. At the same time, if you want to know the electricity bill and everything for each light and column, easy to do it by IoT system. So this small application for the street light, you can always control the light, like you can make it low or high, dim, lumens. So easy for others. For example, at the night, some place they want to make low, or sometimes they make high. They can change also the color of the light. For example, if there is any participation, something like this, they can also change the color. And this is one project has been done before. And we show here how the lumens is very high because we made this lumens based on this side recommendation. So if you can see, there is no black point on the light. So this all because of IoT system. Also, by this dashboard, you can see how we can generate power every day, like how many kilowatt, what is the electricity bill for each light, and if efficiency of each light can be also monitored. This avoid maintenance issues. We can monitor all the light by this technology and easy for us to understand if any problem it might be happen in the future. This also one dashboard to monitor the status of operation. For example, is it on or off? Is it like high efficiency or no? Is this online or no? And same time, if you want to use internet system, also you can use. For example, for the walkway, something like this, you can add the SIM card and you can use Wi-Fi. And for this one, this dashboard show tracking for the location of the pole. For example, if anyone want to steal this pole, for example, solar, or even if the light is on or off, it can send message to the SCADA system easily to see if all okay or some issues. This can be programmed for one SCADA system with big screen, so easy for other to diagnose and understand what's happening on this system. This also show how you can control the brightness levels, like more or less, and also you can change the color from this dashboard. And this show if any light not work efficiency, you can control from here. You can even diagnose, and it will give you what's the problem in this light and what's maintenance part you need before you send the team. So nowadays, no need to send the team to find where is the problem. You just can send the team to solve the problem, which is already you have it and you know everything about it. If the people go there, they know they have to change bulb, wire, any issues, it will show. And this also some of the dashboard for on off. We have big problem with the solar panels light. For example, not all of them, they can work equal. Some of them, they work like before 2 minutes, 3 minutes, 4 minutes. With this system, we can put the timer and make all of them work together and off together. And even if there is any shade, for example, from the top or something like this, nowadays, some people, they fix the solar light and there is some shade. If there is a shade or light opposite, the solar will be not work, solar light. With this system, easy can be work. And this can show the maintenance report for each light, daily, monthly, yearly. So even it can help you to show the KPI for the government and for the maintenance department. So with this system, you can easily to monitor the KPI. This shows how the efficiency of charging and discharging every day. In case the winter time and also summertime, easy for you to understand this. And this will help you to design proper light and proper things for the place which is you want to work on it. So as what I mentioned in the beginning, nowadays in the walkway or playground area, you can put Wi-Fi from street light, you can put CCTV, and also you can put a cleaning system, which is easy to maintain by itself. And this one of our smart pole, if you can see, we use the IoT system. You can use a 360 camera, and also you can use one box, light box for advertisement. It can be also as a screen. And also you can use a charger mobile. All of this can be used only by solar without AC power. And also 5G is available and you can use the IoT here. This one of our smart branch, which can be used. And same, you can put the advertisement, there is a cleaning system on it, easy for you to make full control from your side. For example, if you fix like 30 pieces from this, any place in the world, you can control from your office. And you can fix a CCTV, speaker, and air fan, and Wi-Fi, and also USB charger, and something like this. And this is also, we can use it for bus station. So nowadays with this technology, it can, the people who stay inside, they know what time the bus can come. And if there is any delay, it can show, because this IoT system can control, can monitor all the bus station and also the bus location. So easy for the people who sit there, understand what time the bus can become and something like this. And also you can use it for advertisement. So easy for you to put advertisement from the office and you can change all of this. Thank you for your time. I am free for any questions.
Thank you, Mr. Ibrahim. Mr. Ibrahim, I'm following to your presentation and you speak about the IoT and its application. You presented how you capture different application, especially when you reduce the response time for any problem happening. Also, the maintenance report, advertising, and the bus stop station, which give you the schedule for the bus, and many application which required the network to interact with different device for the benefits of society. I also noticed that you provide insight about utilization of energy, which is really highlighting the energy transition in the near future. Thank you, Mr. Ibrahim, and I'm giving the mic to Dr. Abdel Boualem من المغرب from Morocco, Moroccan wearable artificial kidney we walk operation. I hope that I pronounce your name correctly, Dr. Abdel Boualem. Mic is yours.
Abdullah Boualem.
Abdullah
السلام عليكم
بوعلام.
ورحمة الله. هل
أهلا
تسمعني؟
دكتور. أسمعك
بوعلام.
واضح.
حاضر، شكرا. Hello everyone. I am Abdullah Boualem, research professor at the National School of Electricity and Mechanics in Casablanca. I am here to introduce the work of our biomedical engineering research unit. This is multidisciplinary teams affiliated to laboratory in Faculty of Medicine and Pharmacy at Hassan II University of Casablanca. Our primary goal is to improve dialysis technique while simultaneously reducing their environmental and financial impact. As it stands, most dialysis methods are limited in scope because they are designed around the machine itself, rather than tailored to meet the specific needs of patients with end-stage chronic kidney disease. Our team recognizes the shortcoming of traditional intermittent dialysis techniques, and we believe the solution lies in a revolutionary approach, the development of portable dialysis system. We call it MORWAC, Moroccan Wearable Artificial Kidney. In short, MORWAC is our vision for a patient-centered, environmentally friendly, and financially sustainable approach to dialysis. I will share my presentation. It will be, today I will be presenting on MORWAC, our innovation in wearable artificial kidney technology. This device is designed to address fluid overload issue in patients with renal or cardiac dysfunction, offering a portable alternative to traditional treatment. To give a clear overview, here is our agenda. We'll start by discussing the background of dialysis.
Dr. Abdullah, is your screen slides shared? Are you going to share any slides? Can you hear me?
Dr. Abdullah, your video is frozen.
Yes, Doctor. I was afraid that's from my side. Dr. Abdullah, I believe
he had a
he
lag
is
and
disconnected.
yeah.
Yeah. Maybe he is coming back. Mr. Abdullah, did he join?
Not yet.
Until then, until Mr. Abdullah is joining, let me talk about my experience with smart cities and utilization also of Internet of Things. We have like artificial lift pumps lowering in different location, geographic in North and South and West Kuwait. And we created like a sensor integrated with a device to record of per second reading, so that for any pumps that going down or trapped, it is triggered in the system, and we need to send a crew for restarting the pump to location. When we connect all the sensors into one smart monitoring system and the SCADA system, which allow us to program a business rules of a specific engineering equation that can read different parameters, which predicts when we expect those type of pumps to be trapped due to electrical surge, due to mechanical problem, or due to performance of their lives. and we monitor that performance, and so as exceeds the limitation, even if manufacture of their one lifetime. In addition, we have maintain the maintenance scheduled also for those type of pumps. I don't know if Dr. Abdullah is joining, which I would like him to join for even this comment and to proceed with his lecture. Let me put my view to see all the attendance, to see if Mr. or Dr. Abdullah is joined. I don't know if he did join. Let me call. Uh,
I have also tried reaching him out. I'm waiting for his response.
okay. So do we have a speakers so that we can go with the time utilization online as a backup? I don't know. Let me ask.
Okay, I see Dr. Abdullah and the attendees, so I have requested him to join. We will wait. I believe they're having some connection issues because I could see him before and now he's gone again.
Let me try to open maybe a presentation I prepared before, just a backup. If Dr. Abdullah is not joining. This is Dr. Abdullah. This is the one who joined? Dr. Abdullah? Oh, sorry, this is Ayman. We are waiting Dr. Abdullah to join in this session, and I hope
I just had a call with Dr. Abdullah, and he said he has some technical issues with his PC, so he needs 10 to 15 minutes to rejoin the session.
Okay, do you have the schedule for the session? Anybody?
No, I do have, it was only Mr. Ibrahim Al-Mutawa, then Dr. Abdullah, and with you as the round table, Dr. Hassan.
Okay, is Mr. Ibrahim Al-Mutawwa available? So,
I believe he gave his session and he left. Mr.
Oh.
Ibrahim? No. If you have anything to share or discuss, Dr. Hassan, maybe you can enlighten us. You're on mute, I'm sorry.
oh, yes, let me find something and I can cover it.
Thank you.
Okay, let me try to share the screen. And let me know if everything is available, is showing.
Yes, your screen is visible.
Okay, great. Let me put it as an... Okay, let me give you an introduction about myself. I'm engineering background as a petroleum engineer, master from MBA from Maastricht Business School, researcher in different field. One of the fields that I'm focusing on now is the digitization and the workflow within oil sector and the e-commerce. I'm certified as a black belt master Six Sigma, in addition to Project Kaizen proven. I will give you introduction about the way of thinking. Every companies and government, they are looking to increase their capability. And it's very easy to do those type of three elements of capability. Either you enhance or develop your people by giving them the training, changing their and advance their skills. Also, you need to look to your processes, how things are done. If you are a manufacturer to product, you need to see the whole manufactured line or product line, and you need to revisit the processes, how you do optimize your costs through automation and utilization of your processes steps. In addition, how you are utilizing your technology. And the technology trigger here is very important because sometimes companies, government utilize their technology in a different way, but it needs to be effective first before it goes to efficiency. What do I mean by effectiveness and efficiency? That you need to go and utilize the technology to go to the right direction of your strategy and mission, other than looking for doing things fast but at the end you lose your track to different direction. Different studies of innovation, how you do innovation, especially your design, based on Harvard Review number 86, which consider around the most probable 40 elements to do the innovation. Either number one of segmentation, like we talked about a product or your processes. If you segment part of your product, sometimes you come up with innovation of a new product to the markets. The other part is taking off one of the features within your product, and other part of changing the local quality. You change some part of your product within your manufacture. In addition, you do symmetry, or you do merging, you do some nesting, anti-weight, different element here for the 40. I highly recommend you to review those elements and to try one of them to do your innovative product, either to utilize your technology or you design your product. And here is like an example that always I do or started with my presentation to explain the appropriate way of doing the innovation, like the treadmill. If you revise the things instead of if you are running and the place around the place, no, you give the ground is running, but you are in a stable position. Otherwise, you change part of the product, like the straw, how it is innovative branding of the new straw. In addition of merging, everybody know the iPhone and how it's merging all different application into one device, like using phone, internet, emails, in addition to YouTube and radio and TV.
Dr. Hassan, sorry to
Yes.
interrupt you.
Yeah.
Dr. Abdullah is here, so would you like to
Great.
continue?
Great.
Session?
I really enjoyed and would like to hear from him. I was covering also just his place. So Dr. Abdullah or Mr. Abdullah, please, if you are here, open your mic and the floor is yours.
Thank you. Dr. Abdullah, can you please? Yes, thank you.
Thank you. I apologize for this interruption.
It's okay دكتور عبد الله. اهلا دكتور هنادي. اهلا يعطيك العافيه.
اهلا دكتور حسن، شلونك؟ ترى قاعد اسمعك بس رد على التليفونات.
الله لا I was joining already.
Okay.
Thank you.
I already joined, and Dr. Abdullah, he wasn't online. He had technical problem. He is rejoining now. Please, Professor Abdullah, floor is yours.
Thank you. Today I will be presenting on more work, our innovation in wearable artificial kidney technology. I don't know if I have shared my presentation or not.
You can share your presentation now. Again, you can click share screen, please.
Wait, this one.
The green bottom.
Yes,
Okay,
yes.
that's it. Yes.
Great. It's already sharing, Dr. Abdullah. Floor is yours.
Yes, sir. To give a clear overview, here is our agenda. We will start by discussing the background of dialysis, move on to the limitation of cure and treatment, and then introduce the MORAC device. We'll also cover its patent status, prototype development, testing, and conclude with the SWOT analysis. Dialysis has been a life-saving treatment for kidney failure for over 60 years. However, outcomes for long-term dialysis patients are still significantly lower compared to the general population. Survivor rights highlight the need for alternative solutions that improve both lifespan and the quality of life. This graph illustrates the 5-year survival rates of patients with various chronic conditions, including cancer, heart disease, and long-term dialysis. As we can see, survival rates for some cancers like prostate and thyroid cancer are relatively high, reaching close to or over 80%. Meanwhile, patients undergoing long-term dialysis have some of the lowest survival rates, significantly lower than those with heart failure or even certain aggressive cancers like leukemia or stomach cancer. This comparison highlights a critical point. Despite 60 years of dialysis, patients still face poor long-term outcomes. It underscores the urgent needs for innovation like the MORWAC device by offering a portable, patient-centered alternative to traditional dialysis. We hope to improve both the quality and the length of life for this individual. MORWAC is designed to give patients greater freedom, reduce hospital dependence, and address complications that current dialysis treatment struggle to manage. After 60 years of dialysis, we are still facing limitations. Dialysis only addresses part of the problem. It keeps patients alive, but doesn't restore their quality of life or independence. Inspired by Plato's philosophy, which suggests we can't cure a part without treating the whole, MORWAC is designed to improve patient care in a more holistic way. Rather than tying patients to a clinic, we want to give them a portable home-based solution that support their overall well-being, not just one symptom. This approach is at the heart of MORWAC's development. Fluid overload is a significant issue for patients with the renal or cardiac dysfunction. Normally, kidneys remove excess fluids and salts, but when this fails, patients face life-threatening complications and a high risk of intensive care unit treatment. Current options are limited, motivating us to find a better solution. Current treatment involve intravenous diuretic and large ultrafiltration machines, which are hospital dependent and often ineffective in the long run. These limitations underscore the need for a portable, patient-centered device that allows fluid management outside the hospital. The MORWAC device is a portable ultrafiltration solution aimed at patients with volume overload due to renal or cardiac condition. It uses section bellows to control ultrafiltration, making it lightweight and suitable for home use. This design empowers patients, providing them with greater independence. Our journey began with a patent in Morocco in 2016. Following its publication by WIPO, we pursued past patents in 10 additional countries, including Japan, China, and the United States. This broad protection allows us a competitive advantage and strengthens Morocco's market position internationally. We developed an initial prototype based on the section bellows system. Using this prototype, we built a mathematical model to accurately describe how suction behaves during ultrafiltration. This model revealed that the bellows pressure profile is ideal for adapting to vascular physiology. We completed the in vitro test with the bovine blood bags. We completed in vitro test with the bovine blood bags, observing how the suction bellows effectively matched vascular needs. It extracts fluid quickly at first, then slows, allowing vessel to naturally refill. This gradual process minimizes strain on the vascular system. Let's analyze Morocco's strengths, weaknesses, opportunities, and threats. Strengths. It is a portable alternative to dialysis, patient-centered, patent protected globally, real-time monitoring and remote follow-up by the doctor using the new technology and artificial intelligence, low power and wide reuse, reducing healthcare costs, and establishing a database for treatment of renal and cardiac disease. Weaknesses. Being early stage, it requires further testing and validation, technical complexity, and the need for patient education. Opportunities. There is growing demand for home healthcare, especially with the shift toward decentralized care, and well as the potential for additional devices, wearable organ, and collaboration with the healthcare providers via partnerships for trial and distribution. Threats, regulatory challenges, and competition from established players could impact our timeline and market positioning, as well as the supply chain disruption and the high development and scaling cost. In conclusion, Morocco represents a breakthrough in wearable artificial kidney technology, addressing limitation in current treatment by providing a portable and patient-friendly solution. We aim to improve the lives of patients with renal and cardiac issues, giving them more freedom and reducing hospital dependency. Thank you for all time and participation. If you have any further question, please don't. I am here to respond. Thank you.
Thank you, Doctor. If I would like to ask more about the real-time monitoring to doctor, which help the patient exactly to what? I didn't catch that point.
Can you repeat, please?
I didn't recognize or realize the monitoring in real time you mentioned to doctor, the devices having real-time monitor with doctor. So how it can help in this device again?
Hello, everybody. I'm Dr. Mohammed Zamd. I'm the partner of Dr. Abdullah in this adventure. And I work on the medical aspects of this invention. The monitoring is provided by multiple sensors which are dosing in real times some electrolytes like sodium, potassium, calcium, bicarbonates, and chlorine. That sensors are placed on the ultrafiltrate side, simply because when we are making ultrafiltration, we are extracting liquid, and this liquid has the same composition as the plasma. So we can, by dosing that electrolytes in that ultrafiltrate, we can really have a good idea on the global electrolytic balance of the patient. This is the first point. The second point is that by using this device daily, you can have a good curves of the evolution of the weight at the first time. We can have also evolution of blood pressure. We can have evolution of the water containment is somewhat now we cannot decide which amount of water and salt we should have in a patient with an age or a race or a sex determined specifically. The equation we have are made very long time ago. This is the first thing. The second thing is that they were made in patients of Caucasian race, uniquely. We do not have, for example, equations responding to that issue in African population, in Aborigine, Australian Aborigine population, etc. So now the idea is to make the MOWAC device an A on this exactly really very specific issue, which is what is the amount of water and salt optimally for a singular individual patient. And now during the use of this device, we will have the opportunity to have many parameters that we can enter in an equation via an artificial intelligence that can will inshallah give us the opportunity to have a new and very accurate equations to really respond to this issue. I hope I
thank you. Clear.
For real times, the doctor can change prescription of diverse parameters, and he receive in real time parameters of each patient. So the doctor can supervise many patients in the same time.
Effectively it's the prototype of the new era of telemedicine. Now, in order to have analysis of, for example, electrolytical balance of the patient, you have to take blood from the patient and to send it to the laboratory, and then you will have the answer 1, 2, 3 hours later. But with MORWAC, all that data is available on real time. The patient with his device is directly connected to his smartphone, and the patient can know at each moment, he can know really how much sodium he has in his body. This is the first thing. The second connection is to the doctor. The doctor should have the opportunity to consult, to know exactly the evolution of each parameter in real time. And the third connection is to our servers that collect this big data in order to use it, as I explained, to create new equations to really know what is the impact of the intoxication by water and salt. This is the 3 ways of connection of MORWAC.
Thank you, Professor Abdullah. Dr. Hanadi, I believe closing of our session for the smart city.
We don't want to close it. We will need to close it on time, Hassan. We will open discussion. I think Ibrahim is there. You can discuss with Ibrahim about the outcomes value for economic and from social perspective for their inventions. Okay? And
Yes.
you can take also the part of that. Ibrahim, you can discuss with Ibrahim, because the session will be closing at 3 o'clock. Before 2 minutes before 3 o'clock, we can.
Okay. Is Ibrahim here? I can't see Ibrahim, but also I would like
you can speak about your you can take the floor,
also
Hassan.
okay, Doctor. But also Dr. Abdullah, I would like to hear about the economic value. Is this device have been implemented within the region or internationally in Europe or USA?
Not yet.
It is started as a patent now.
No, we are now at the final prototyping. We used a prototype to make all the experiment we showed, but now we need really to have a final prototype which can give us the opportunity to really make an animal experimentation in order to have an authorization to put it in the market. Now we are at this specific phase, and we are looking for investors who will help us to not only finalize that animal tests, but also to make clinical trial, because in medical domain we should give the evidence that we are better than what is used now. So we need to make clinical trials, and for this clinical trials, of course, we'll use it in human. But before this, we have to obtain this authorization from medical authorities of each country. It's not simply a patent, just a patent. When we have a patent in the medical domain, we should obligatory to have made a clinical trial in order to give the evidence that we are best than what is now using.
Can you explain to us about the innovation or the patent, especially in healthcare sector, and you are dealing directly with the human body? What is the different step than any other processes to patent such device? So what is exactly you are going through now that is different than any other product that is utilized in the market?
And in the other products, you just need to make evidences of efficiency and safety of the use of your invention. But in the medical domain, we have, in fact, 4 stages. The first stage is the stage of the innovation itself, the discovery of the device, for example, it's prototyping, it's testing on in our case on blood, on whole blood, bovine blood. The second phase is to use it in the animal in order to prove either efficiency and safety. The third phase is what we call stage 3. It's the first clinical trials. The clinical trials are designed to prove that this device can be used in human without any risk for the health of the human. And the stage 4 is to prove that we really what you invented is better than what exists. Example, in our example now for treating the hypervolemia, which means that in your body we have a large amount than normal of water and salt. We use actually now, currently we use diuretics, which are some medication administered intravenously and who keep your kidney producing more and more urine. So you are extracting physiologically the excess amount of water and salt. But in some cases, there is a resistance to that diuretics. Your body becomes resistant to that diuretics. So the idea is that in this case, especially in this case, we can use a machine that will make an extracorporeal extraction, and that machines exist now, but they are bulky, very huge machines. The idea of our machine is that, and we need, of course, to use that machines, we need to hospitalize a patient, to put him in intensive care units, and to really use very, very important resources. The idea of MORWAC is to make this, but simply in the doctor's office. And we can do it with MORWAC. We can do that simply without the need to hospitalize the patient, to make the patient in an hospital or in an intensive care unit. So the difference, the main and the most important difference between the patent in the other domains of engineering, for example, regarding the medical domain, is the need, the really important need, first, to make it the maximum safety as possible. And the second point is that we cannot, for example, give the opportunity to commercialize a device if this device do not give us the opportunity to make better than the current treatment. I hope I understand
great
the question.
discussion, Hassan. Great discussion. The invention passing for commercialization, the commercialization process taking different phases to reaching to the market, because the most important things for the investors and also for the end user, the economy value is not only the technical value. The technical value, it's most important. But also the most important thing for the investor is the economic value. Based on that, we need to working hard on converting our invention to be capable, to be usable for the market from economic aspect.
Of course.
حسن ينظرون هذا تنادي ترند تختم السيشن.
Yes, with this we can close our smart cities session.